You go. Hello, everyone. My name is Samantha Biebeck, and I will be covering my research with you. That is, what role do plant-based diets have on individuals experiencing mental health conditions? A systematic review. This research has been done through Eastern Illinois University for the course NTR 5610. First, I will provide an overview of the presentation. We will begin with an introduction, which encompasses a background of the information, including some statistics and some further suggestions. Following will be my purpose statement, the reasoning behind why this research is so pertinent and why I decided to conduct it, and what we're trying to find from this research as well. Continuing, I will explain an overview of plant-based diets, subtly delving into each one and trying to best define um, what they encompass. And the last part of the introduction will explain the full array of mental health disorders, as well as which mental health disorders I will be zoning in on for this specific research. Continuing on, I have conducted a review of my literature, which I will share with you all. I used many methods. We will first discuss how I utilized the spider method to better decide which articles I wanted to include and whether they were relevant or not. Um, Continuing on with more methods, I will discuss my article selection and how I went about that, including which key terms I used. And I also included how I had inclusion and exclusion criteria. So there were very many articles to begin with, in which I had to decide whether I wanted them to be in English, to only encompass one specific mental health disorder. I had many options, and I ended up deciding which criteria I would include and which I would exclude, which we will talk about in the next few slides. I also had a table of data extraction. A total of 11 articles helped me extract data to continue on with this research and cross those articles to find a complete conclusion to this research. Another tool that helped assist me in the review of this literature was the CRAP test, um, and it also helped me decide what was relevant to include and what was not relevant. In addition, I utilized the Prisma diagram. It was very useful in helping visualize how many articles I truly started with and why I took out each one, and how I really came down to these 11 articles that I found most important to compare and contrast to finally find a conclusion to. And we will have a discussion over the entire literature as a whole and what I have concluded from the literature that I've reviewed. And lastly, as in that portion, we have the strengths and limitations of my research. There were many things that made this very strong research, but as with all research, there were some limitations that I would like to consider given the opportunity to further continue this research. And lastly, we will have a portion of the conclusion in which I will summarize my findings, and I will also use those summarized findings to apply it to future implications, both for dietetic practice and for research. The introduction. So we have some statistics 19.88%, 86% of American adults in 2022 experienced a mental illness. That is equivalent to 50 million Americans. That's quite a large percentage for something that is not necessarily focused on in the realm of nutrition. And so I found it very interesting to see how that applies to this large population. In addition, one in every 8 people live with mental illness worldwide. So this is not something that we're only experiencing in the United States. This is something that people experience worldwide. It is prevalent and it is important to focus our research on. Also, mood disorders are significant predictors of suicide, and that accounts for over 800,000 global suicide related deaths per year. So, not only does this research cover what we can do for those who are experiencing mental illness while they are living, but we can possibly help prevent any of these fatalities that are contributed that mood disorders contribute to. So, some suggestions from previous research. It has been suggested that high quality plant based diet may be protective against depressive symptoms in vegans and vegetarians. So, that is something that we will be trying to prove either right or wrong. Um, do these high quality plant based diets actually contribute to protect us against depressive symptoms um, in both vegans and vegetarians? It has also been suggested that poor diet has been found in recent studies to contribute to the risk of mental health disorders. We know that there are many health disorders that are related to poor diet. Poor diet is a pretty loose term, but it has been correlated to vegetarianism or plant based dieting, health benefits, many health benefits. In addition, the possible impact of dietary changes on existing mental illness is largely unknown. So, this is a field that hasn't had a large amount of research quite yet. There has been research focused in certain areas, but broadly, mental illness and plant based eating has not been completely connected enough to really find conclusions. So that made me curious, and that um, made me feel very adamant about finding some answers to this research. And vegetarians have reported more positive mood in some studies, but have described more psychological symptoms associated with anxiety and depression in others. So while there might be an increased mood, there has been linkage to both anxiety and depression. So there's a lot of mixed, there are many mixed suggestions to this correlation. Is it positive? Is it negative? Is there no effect at all? Um, so, my purpose statement, the objective of this research is to assess the effects of plant based diets on individuals with pre existing mental health disorders. You might be asking yourself, so how do we define plant based diets? It can be quite loosely defined if not researched correctly. So, I will cover the vegetarian diets that have recently been coined plant based. The first I would like to discuss is the lacto vegetarian diet. This excludes meat, fish, poultry, and eggs, but may include dairy products. Um, and its sister diet would be the ovo vegetarian diet. This excludes meat, poultry, seafood, and dairy products, but may allow eggs. So while the lacto vegetarian diet excludes eggs, The ovo vegetarian diet does include them, and vice versa with dairy. And then we have our lacto ovo vegetarians. They do still exclude meat, fish, and poultry, um, but they may include dairy products and eggs. It is a typo where it says it allows fish intake. Um, Pescatarian diets are they exclude meat and poultry as well as dairy and eggs often, but they do allow for fish. And lastly, I would like to discuss the vegans. Vegan diets exclude meat, poultry, fish, eggs, and dairy products. This diet is the least loose of them all. It restricts quite a few areas that the others do not. There have been many benefits linked to all five of these diets um, that could suggest improved mental health state as well. So we will now cover mental health conditions. First, we have anxiety disorders. This might be one that you have heard of. These include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias, such as um, those that do affect your mental health. We, in addition, have mood disorders that include depression, bipolar disorder, and cyclothymic disorder. Many people misunderstand, and they do include depression and anxiety um, in the same realm, though they are completely different disorders. In addition, we have psychotic disorders. Um, the main one is schizophrenia, though there are others included. Eating disorders are also mental health conditions. Anorexia nervosa, bulimia nervosa, and binge eating disorder are three of the most common eating disorders. Impulse control and addiction disorders. These are possibly less talked about in everyday talk, but they include pyromania, kleptomania, alcohol addiction, and drug addiction. And we also have personality disorders. Antisocial personality disorder, obsessive compulsive personality disorder, histrionic personality disorder, schizoid personality disorder, and paranoid personality disorder. These might be less talked about as well. And obsessive compulsive disorder has its own subset. So a lot of it can be confused that OCD is combined in with anxiety or mood disorders, though it stands alone as its own obsessive compulsive disorder. And lastly, I covered post traumatic stress disorder, also known as PTSD, which stands alone in its own category as well. For my research, I focus specifically on anxiety disorders and mood disorders because focusing on all of the disorders just was not realistic to find enough research and to really synthesize that research. And to reiterate my purpose statement, the objective of this research is to assess the effects of plant based diets on individuals with pre existing mental health disorders. Now I will review the literature. I used a search strategy that we use the acronym SPIDER for, which simply stands for sample, phenomenon of interest, design, evaluation, and research type. For my sample, um, It was individuals consuming a plant-based diet that are also experiencing mental health conditions. So they had to be experiencing both simultaneously for these studies. My phenomenon of interest, there must be there had to have been a presence of mental health conditions in individuals who eat a plant-based diet, um, keeping along with that sample. The design was qualitative data in relation to plant-based diets and mental health. It wasn't exactly easy to find quantitative data for this specific topic. When we're talking mental health, that's something hard to put a number on. You can't draw someone's blood and find out um, their mental health status from one of their readings. It's something that is more qualitative. And onto the evaluation portion, it had to be research in relation to plant-based diets and mental health. And the research type that I was looking for was qualitative, and I just previously mentioned why. So, my methodology for my article selection, I kept it pretty simple with only two databases. My reasoning for only keeping two databases was because it got messy, to keep it, you know, for lack of better words. Um, I found enough data with using just PubMed Central um, and Google Scholar. I was able to find plenty of research in which I had to cut down because there was so much research. Um, in addition, I used some suggested articles that I found along the way. There were some authors that I found had many research studies that were quite similar that I was able to use. And if I was not able to use those research studies from those authors, I just scrolled down to where the references were and found even more research that connected to what I was looking for. So the references, that's where I found a decent bulk of my additional resources that I did not find through PubMed or through Google Scholar. The key terms that I used in my search were vegetarian or vegetarianism. Those were a bit alternating, as well as plant-based diet, which I did not have as much luck using that term plant-based diet as I did with the terms vegetarian or vegetarianism. And I believe that's because the term hasn't been coined for as long as that vegetarian or vegetarianism. So plant-based is still a newer term to the research realm. In addition, I used the key term mental health and the key term mood disorders. I had a lot of luck with the key term mental health, a little less luck with mood disorders. As I mentioned previously, I had inclusion and exclusion criteria. Um, for my inclusion, the articles had to be in English language, which I thought could be difficult because in previous research, I found a lot of different languages for what I was researching. But I got really lucky this time, and all of my research showed up in English. But that was one of my criteria, and it worked out well. In addition, the articles had to be equal to or less than 15 years ago. I originally wanted my research to be within a 10-year span, but there was an article from 2007 um, focusing on women age 22 to age 27 um, that consumed a plant-based diet, and it focused on their mental health state. I found it very important to include, and so I went from 10 years to 15. It had to include a plant-based diet. We were not focusing on omnivores or carnivores. This was focused on those who consumed either the lacto-ovo vegetarian diets, the vegan diet, or the pescatarian diet. Um, it had to include any kind of mood disorder or anxiety disorder. As I had previously mentioned, we're just going to go back real quick. I only wanted to focus on the anxiety disorders and mood disorders to completely knock out all of the others below and really focus on what I could find research on. All right. And lastly, they had to be primary research articles. And the articles that I did exclude could have been foreign in language if I had found any. I excluded any articles that were over 15 years old. I excluded any secondary research articles, um, which was somewhat disappointing because there were some really great ones that I eventually found out were not primary, um, but they were still interesting to learn from. And I excluded any research that covered other diets. As I mentioned, there were some that focused on mental health but did not focus on plant-based eating. They were focusing on um, those maybe on a Mediterranean diet. There was an article I excluded for that reason, or maybe it focused on any other diet. um, I also excluded research that focused on other mental health conditions aside from those mood disorders and anxiety disorders. So here's my data extraction table. I comprised 11 articles to synthesize this systematic review. And the majority, as you can tell, were cross-sectional studies, which I actually found very beneficial. Um, and there were a couple longitudinal studies, but they were in addition to the cross-sectional studies. So it was quite helpful. Um, what was interesting was that many of the research studies were Australian based, and not many were focused in the United States, which frustrated me because there should be more research on this. And I would really urge those in our nation to focus on this issue. If other countries are focusing on it, I find it important that we focus on it as well. So, in my first article, that was in 2017, fairly recent. It was a parallel group, single blind, randomized control trial. Um, it was a sample population of 66 people, which is quite small. Um, the age range was 18 to 99 years old, so that was quite a large range as well. Um, the focus was in Australia, and it did provide dietary improvement when guided by a clinical dietitian that may provide an, an efficient treatment strategy for the management of this highly prevalent mental health disorder. So this article found positive health outcomes mentally in association with plant-based diets. The following article in 2021, it's very, very recent. It was a cross-sectional study of 219 individuals, again, small sample, aged 18 to 44. The reason they chose this age group was because that is determined to be the healthiest category of age groups. This was also an Australian focused study. Their findings align with the association between high quality vegan and vegetarian diets and decreased depressive symptoms. So, again, we have that positive outcome. LaValle, my third, this was in 2019, cross sectional and longitudinal analysis. This one was quite a large study. Um, And that's because it covered multiple different countries, people. 8,065 in the cross-sectional study, and then 14,352 people in the longitudinal study. The age range was unspecified. I tried pretty hard to look for that, um, but it covered many age groups. It had focus in Russian populations, Chinese populations, German populations, as well as the United States population. It concluded that vegetarianism or plant-based eating is not associated with mental health in the US, Russia, or Germany, but it was associated with anxiety and depression in China in a negative way. So we have that third study that completely contradicts the first two, but only in the one country. Interesting. Continuing on, I have a cross-sectional study from 2020. Uh, it's larger, but not as large as the multinational study before. 2,449 sample population. The age group was specifically 14 years old to 91 years old, and it was in German populations. The results more closely align with those that have documented a higher risk for more psychological symptoms associated with depression. So we have two studies so far that have supported these positive impacts of plant-based eating on mental health conditions. And now we have two that are flip-flopping and saying that, okay, in specific areas in China and then now in Germany, there have been an association. Continuing on from 2010, another cross-sectional study, smaller sample of 138. The age was unspecified. But what is unique about this study is that it was the one study I found within the United States. It did only focus on the southwest region of the United States, so there were just a handful of counties. They weren't even full states, but it did show a favorable mood profile that observed when within the vegetarian diet. So more positive. I have a cohort study from 2021 of 10,062 people. The age again was unspecified. These were among Taiwanese people, and compared with non-vegetarians, the vegetarian group had a lower incidence of depressive disorders. My 2007 study that I previously mentioned is a cross-sectional and longitudinal analysis of 9,113 people. This focused on women specifically aged 22 to 27 within the Australian population. It concluded that reports of poor mental health of these young women may be of clinical significance. So there was a negative association between mental health and the vegetarian diets consumed within this age and this sex in this specific area. Continuing on, in 2022, we have the cross-sectional study of 6,578 people, age 18 to 90. This was a French sample, and it concluded that it did not present an increased risk of anxiety or depression. So there was no increased risk, but it didn't necessarily explicitly state whether there was the opposite effect. Another cross-sectional study of 4,181 people aged 18 to 65 within a German sample concluded that in Western cultures, vegetarian diet is associated with an elevated risk of mental health disorders. So again, we're flip-flopping again. That was a negative outcome. In 2021, there was another cross-sectional study of 9,426 people. Age was unspecified, though this was conducted within the United Kingdom. And depression was more prevalent among vegetarians compared to non-vegetarians in this present study. So that had a negative association. And lastly, in 2019, the cross-sectional study of 892 people aged 40 to 83 was conducted among South Asians within the United States. This cross-sectional analysis showed that vegetarian diet was associated with lower odds of depression. So we have a whole mixed bag of positive correlations, negative correlations. So what's the catch here? All right. So this is my CRAP test. I used the guidelines that were posted within our content online, and found that the majority of my studies completed the 15 out of 15 for relevance. The only two studies, so Beeshold and then Baines, those two were a bit older. I believe Beeshold was conducted in 2010. And then Baines was in 2007, but they were both good enough, important enough articles to include. They had pertinent information. I could not nix them. All right. My Prisma flow diagram. So I utilize Prisma to sort through my articles and eventually have the qualitative studies of the 11 articles that I needed that we had just discussed. I began with 4,009 research articles through using PubMed and Google Scholar. Additionally, I found 5 more resources, and those were found in the references from other articles. Records after duplicates were removed. There were no duplicates. Records screened. I excluded other sources and found full text articles in which only 28 were existent that I were able to access. And I included 17, or I excluded 17 of those articles for one reason or another. Some of them did not have conclusions that aligned with what my purpose statement was looking for. And that was the biggest reason. And I eventually had 11 qualitative I had 11 articles that I was able to create a qualitative synthesis with. Okay. So I'm going to discuss three of my research articles that I found most important to discuss. I've mentioned this one a few times. In 2007, there was a research conducted on 9,113 women aged 22 to 27 years. And it included in a cross-sectional data analysis of the Australian longitudinal study on women's health. And they were defined as, within the study for the design, they were defined as non-vegetarian if the participants reported including red meat in their diet. They were defined as semi-vegetarian if they excluded red meat in their diet. And then defined as vegetarian if they excluded meat, poultry, and fish from their diet. So as you see, the definition of vegetarian is quite loose and has changed throughout the years. So it's important to touch on the specifics behind each term every time it's brought up. Some methods within the study: the medical outcomes study short form health survey also called SF-36, measured perceived general health and well-being. Summary scores for mental health were derived from 36 items of the SF-36. And results found. Data strongly suggests poorer health as evidenced by several indicators, including the SF-36, previously mentioned, reporting of diagnoses and symptoms, and greater use of medications for mental health problems. So it had a negative outcome. And touching on research that's more recent, we have Chang, as well as other authors in 2021. The research design. Researchers analyzed data from the Zhuxi Vegetarian Study, TCVS, which is a prospective cohort study following 12,062 participants, quite large. Within their methodology, participants age less than 20 who had depressive diagnosis before or within 1 year of study they were excluded from the study completely. So they could not be less than 20, could not have had a depression diagnosis within 1 year of the study. This resulted in 7,006 non-vegetarian and 3,571 vegetarian participants. The diet was assessed through a 57-item food frequency questionnaire, also referred to as FFQ. Those who reported eating meat or fish in the FFQ were classified as non-vegetarians. Independent sample t-tests and chi-square tests were used to compare baseline characteristics between vegetarians and non-vegetarians. So there was a bit more of a quantitative analysis using that t-test, but the focus was on the qualitative research within the study. There was a total of 284 incident cases of depression that occurred during the follow-up period. Non-vegetarians accounted for 206 cases, while vegetarians respectively accounted for 78 incident cases. Incidents also showed an increase in those 50 years and older, as well as those of female sex. The main finding is that the main findings of the study was that vegetarians had a lower risk of developing subsequent disorders compared to non-vegetarians. Findings were consistent in further stratification analysis within the subgroups of age and sex as a protective trend. So this study found that the age was a huge factor and sex was a huge factor. The third study I'd like to look at is still quite recent, but in 2019, so pre-pandemic, seems forever ago. The design of the study, it was a self-report questionnaire data, which was obtained from a large-scale multinational cross-sectional sample, including 2,007 representative adult members of the German population, 3,020 representative adults from Russia, and 3,038 representative adults from the USA. Participants for the longitudinal analysis include university students from Germany, 1,608 participants, and China, 12,744 participants. Methods used in this research. Data was drawn from the BOOM, acronym for Bochum Optimism and Mental Health Studies, a large-scale cross-cultural longitudinal investigation of risk and protective factors in mental health. Vegetarianism was assessed by a simple "Are you vegetarian?" question. Categories were no, yes, no, meat, so answer no if you eat no meat but fish, and then answer yes if vegan. And then the control variables within the study were relationship status, socioeconomic status, urbanicity, quality of health, BMI, and family affluence scale. This was the one study that took those factors into consideration and tried to control for them, which I very much appreciated. Results of this study: vegetarianism is not reliably related to positive or negative mental health in US, German, and Russian representative samples. Vegetarianism is related to slight increases over time in anxiety and depression in Chinese populations. Future studies should examine nuances of vegetarianism in more detail and their links with mental health, including dietary composition and cultural beliefs and economic circumstances. So I found that pretty interesting that culturally there was a difference. That was where I found the largest difference. Okay, for my discussion. So, what do my findings mean? They mean that adhering to a plant based diet currently shows no effect, positive or negative, on mental health conditions. The conclusions were so mixed. So, there's currently no one answer. Further research is necessary to conclude findings that control for demographic factors such as age, sex, socioeconomic status, cultural beliefs, among many others. That is why I found it so important to include the previous research study, was because it did cover some of those demographic factors. As with any research, there were strengths and limitations. The strengths were my use of Prisma and the inclusion. I was also able to stick to my inclusion parameters of including only the English language, only or only research that was equal to or less than 15 years, research that was focused on plant-based diets, also mood disorder or anxiety disorder solely, and then also only primary research articles. Another strength was that there were consistent study designs. Many were cross-sectional. That made for easier synthesis. My limitations of this research: much of this was self-reported, and that can very much skew results. In addition, there were little to no interventions. I actually can't think of a single research article that I included that actually had an intervention. Everything was through observation of turned in questionnaires. Everything was self-reported. No intervention was applied. And in addition, there were inconsistent testing measures. There is no way to test mood necessarily through the blood or and a means that can really be calculated quantitatively. It's more of a qualitative measure, and so that was a limitation that I dealt with. Was that there were inconsistent testing measures. So we will continue on to our conclusion. I have concluded that more research is needed. Specifically in the United States, I find it important. Coates 2020 talks in depth on how there's a lack of research in the United States in comparison to other countries. And it was very obvious when I was doing this research that that is true. And more research is needed that include controlled studies. As I previously mentioned, we need to control for age, sex, socioeconomic status, cultural beliefs. Without control of this, we cannot determine whether whether vegetarianism is actually affecting mental health status or if something else is at play, a different factor not being controlled for. There are professional implications to this research, and those include dietetic professionals currently do not treat for mental health conditions, but may have patients in their care with mental health conditions. So while dietitians are not treating for mental health, they do have those with mental health in their care. So it's something to keep in mind. You might have to include a psychiatrist in on your patient care. It's interdisciplinary. Dietetic professionals should continue to keep dietary care and mental health care separate. Aside from, as I mentioned, including those professionals who can cover this topic in on the care process. Interdisciplinary medical teams can benefit from further research and findings for optimal patient care. My concluding statement: while research correlating effects between mental health and plant-based eating is important to continue research on, the current findings have not concluded a positive or negative effect. So that's my research, and I'd like to thank you. Here are my references, and I hope you all enjoyed. Thank you so much.